Welcome to the Brain Health Hookup. I'm Laurel Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it.
Well.
That's a deep subject.
Ever feel like your body is betraying you? Strange aches, unexplained pains, phantom sensations? You've been to every specialist, but no one can find anything wrong. What if I told you that there's a missing piece in the puzzle, a connection between your emotional experiences and your physical symptoms? Stay with me because in this episode, we're showcasing the fascinating world of somatic healing and exploring how you can reclaim your body and your well-being. By the end, you'll understand why traditional approaches may have fallen short and discover a powerful path toward lasting relief. I met a client this week, a world-weary and tender-eyed woman who sat across from me with a look of utter bewilderment. For years, she'd been plagued by a constant whirring sound in her ears. Doctors had ruled out any physical cause, leaving her feeling lost, scared, and convinced she was imagining things. She'd even started to doubt her sanity. Sound familiar? This is the story of so many people who suffer from unexplained physical symptoms. They go from doctor to doctor, only to be told there's nothing wrong. They start to internalize this message, believing the problem is all in their head. But what if it's not? What if the key to unlocking these mysteries lies in understanding the intricate connection between our nervous system and our emotional experiences? Think about it. Have you ever experienced butterflies in your stomach before a big presentation? A racing heart when you're stressed? That's your nervous system at work, responding to your emotional state. Now imagine those responses amplified, prolonged, and manifesting as chronic pain, strange sensations, or seemingly unrelated physical symptoms. This is what's happening for many people, and they don't even realize it. My patient's aha moment came when I explained the role of the vagus nerve. This incredible nerve, often called the wandering nerve, connects your brain to almost every organ in your body. It's a communication highway, constantly sending and receiving signals. But what happens when that highway gets jammed with emotional traffic? Here's the crucial insight. Emotional trauma, past hurts, and ongoing stress can create disruptions in the vagus nerve, leading to a cascade of physical symptoms. That whirring in my patient's ears, it wasn't a hallucination. It was the physical manifestation of her nervous system reacting to unresolved emotional pain, specifically related to unrelenting abuse she's experienced from toddlerhood into her 40s. The vagus nerve, which curls right around the ears to the brainstem, was essentially broadcasting her distress. Imagine the feeling of your heart pounding in your chest, that feeling of a lump rising in your throat like you can't swallow, like you're choking back tears. The dizziness that overcomes you when you're anxious. These are all sensory experiences connected to your emotional state. Now picture these sensations becoming chronic, persistent, and seemingly unrelated to any obvious trigger. This is the reality for many people struggling with somatoform symptoms. We need a new language to describe these experiences, a way to bridge the gap between the physical and the emotional. That's where tools like the Somatoform Dissociation Questionnaire or the SDQ-20 come in. I use this in my practice. Instead of asking about isolated symptoms in a checklist like any problems with your stomach, any problems with headaches, any problems with pain in your legs, instead of asking those isolated questions, the SDQ-20 explores how these sensations manifest in unusual and unexpected ways. For example, questions about distorted senses, things looking bigger or smaller, smells changing, even feeling like a part of your body has disappeared can offer clues to the underlying emotional distress. The real enemy here isn't being broken or some mysterious illness. It's the outdated belief that the mind and the body are separate. We need to challenge the idea that physical symptoms can't have emotional roots. We need to advocate for a more holistic approach to healthcare that acknowledges the intricate connection between our emotional and physical well-being. We experience this connection because the vagus nerve is literally plugged into our brainstem with no mediating structure or filter. Whatever interference or irritability is occurring in the vagus nerve is fed right into the brain. If you've reported your symptoms, had your symptoms dismissed, and feel so frustrated that you don't even report your symptoms anymore, please know that anatomy supports what you've experienced and how you've experienced it, even if you've been checked out and told you're okay. Now, I know some people might be skeptical. They might say, that sounds a little too woo-woo for me, and that's okay. But I encourage you to keep an open mind. Consider the research on the vagus nerve, the growing field of somatic psychology, and the countless stories of people who have found relief through these approaches. For my client, understanding the connection between her past trauma and her current symptoms was a revelation. It wasn't a quick fix, but it was the first step on her journey toward healing. She finally understood that she wasn't, in her own words, crazy, that her pain was real, and that there was a path forward. She wept openly in relief, and as she reached over my desk for another tissue, she breathed out a lament. No one believed me. I've been suffering all alone. If you've given up on finding the root cause of your pain and distress, I urge you to explore somatic healing practices. From ancient times, people have used movement in healing. Newer techniques include somatic experiencing, EMDR, and groove therapy. There are many ways to address the deep imprints of trauma on your nervous system. My signature model, groove therapy in particular, leverages the power of drumming and community to retune your nervous system, reduce inflammation, and promote healing. It's not just about feeling better. It's about becoming better, more resilient, more connected, and more fully alive. Join me in embracing this new paradigm of healing because you are not too broken to heal. You are wired for growth, for change, and for wholeness.
Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast as it helps this show grow to reach more people who need to make mental wellness fun. You can find a leave a review button as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.